Hi everyone! Welcome to the video on interacting with children with chronic medical conditions and children with child maltreatment syndrome in the healthcare setting. I will be talking about how having a chronic medical condition affects a child's behaviors and what are some facilitating factors for a healthcare encounter with such children. I will also discuss specific strategies for children who are victims of previous child maltreatment, as one is likely to encounter such children in the healthcare setting. Chronic diseases are defined as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. The nature and developmental age of onset of the condition affect the child's coping and adjustment. Congenital physical conditions, for example, spinal bifida, limb anomalies, cerebral palsy, hearing or vision impairment may lead the child to feel different from others. Life-limiting conditions, for example, muscular dystrophy, affect parenting choices and styles, which may in turn affect the child's behaviors. Those who require frequent or prolonged hospitalizations are more likely to have behavioral problems. Children who were born preterm or who have medical conditions of infantile onset may have parents perceive them as special or vulnerable, even if the condition is healed or well controlled. Chronic illness may slow the development of early independence and self-mastery. This may result in rebellion during adolescence. Children with chronic medical conditions may have higher rates of adjustment difficulties and behavioral problems. These are important to understand as the child's past experiences, temperament, and cognitive ability affect how they process and react to the next healthcare encounter. Here are some common behavioral symptoms a child may develop following hospitalization or surgery. When meeting the child in a healthcare setting, there are facilitating factors that can be considered. These factors can be divided into pre and during the healthcare encounter. Prior to the healthcare encounter, it will be helpful for one to find out more details about the child's background, such as what condition the child has, what is the child's current status, how old the child was at the time of onset of this illness, did the child have multiple or prolonged hospitalizations? How did these encounters go? When interacting with the child during the encounter, prepare the child beforehand on what to expect. Do consider getting the play therapist or child life therapist involved early. Stay calm and do not take the child's negative behaviors personally, as these may be a result of the child's past encounters. Be confident, as these children are likely to know what to expect and can sense if you seem uncertain. Do not hesitate to seek help from someone more experienced. Help the child separate the current experience from the past experience. It is also important to manage the caregiver's feelings and anxiety. The child can sense his or her caregiver's anxiety and become more anxious. Involving the child in decision-making will give the child a sense of control. This will help alleviate some of his or her anxiety. Examples of choices include asking the child when, where, or with whom for procedures if possible. An older sibling can also model the experience for the child if this is feasible and if the caregiver feels that this is likely to benefit the child. Moving on to a group of children who may also be seen frequently in the healthcare setting. Children who are victims of previous child maltreatment. Child maltreatment syndrome is defined by the World Health Organization as physical, sexual, emotional abuse, and/or neglect. One may encounter such children in various circumstances, for example, when they are hospitalized in the wards for child protection or medical reasons, or in the clinics. These children may manifest their psychological disturbances in various ways, and it may be challenging to engage them. For those who have a tendency to internalize their feelings, they may present with generalized anxiety and clinginess. They may be overly compliant as they are fearful of being rejected again. For those who externalize their feelings, they may appear to be aggressive or defiant. In general, a responsive approach is encouraged. This has also to be individualized depending on the child's past history and temperament. Some strategies that may facilitate the encounter include understanding how the child was abused is important. For example, a child who was physically abused may be more sensitive to touch or pain. This may evoke negative memories and fear in the child. Maltreated children tend to be wary of new situations and environments. Preparing the child for the encounter, telling the child beforehand what it will entail, and sticking to the plan will help the child cope better. Such children are also likely to be delayed in social-emotional skills and may also have other forms of developmental delay, for example, speech delay. It is important to know the child's developmental age and interact with the child at his or her level. For the aggressive and defiant child, calm down, take a step back before reacting. This could be the child's defense mechanism. It may take time to win the child's trust. Each encounter may need to be brief. Be vigilant and responsive to the child's cues. Before we end the video, let's recap. Even in the absence of a neurodevelopmental disorder, children with chronic medical conditions or who are victims of previous child maltreatment may have behavioral issues that make the healthcare encounter more challenging. In this video, we have discussed some strategies to mitigate this.